today, this is actually quite ironic because it's actually thrombosis awareness today, and that is one thing that we'll be talking about with blood clots. So I just wanted to put that out there. So it's actually quite perfect that I'm giving this speech today. So each day around 274 people die from blood clots. That equals out to about one person every 6 minutes. A blood clot can be a silent killer, taking lives from those who never even expect it. Only 1 in 4 people, their first symptom of a blood clot is sudden death. Blood clots can affect anyone from infants to elderly. And under normal circumstances, blood clots can be very beneficial to help heal from a cut so that you don't bleed out. I will be talking about a few different things that go along with blood clots. I'll be talking about what a blood clot is, symptoms, causes, and treatments. A blood clot is a semi-solid clump that's made of red blood cells, which contain hemoglobin that removes CO2 and carry oxygen, white blood cells that fight infections, platelets that are part of the clotting process, and plasma, which contains fluid and chemicals for bodily functions. A blood clot is a gel-like mass formed by platelets and fibrin in the blood to stop bleeding. Proteins in your blood called clotting factors send signal to each other to cause a rapid chain reaction. It ends with a dissolved substance in your blood turning to long strands of fibrin. These get tangled up with the platelets in the plug to create a net that traps even more platelets and cells. The clot becomes much tougher and more durable. And that is what you can see right there is kind of the yellow is the fibrin of it, which kind of creates like a spider web that traps it. Tiny bits in your blood are called platelets that get turned on by triggers released when the blood vessel is damaged, and they stick to the walls in the areas and each other, and they change shape to form a plug. This plug fills the broken area right here, and it stops the blood from leaking out. When a blood clot is inappropriately inside an artery or vein, they can cause significant problems to your health because the blood that flows past it gets decreased, so it creates kind of a barrier, and it gets harder for blood to pass. As the damaged tissue heals, you don't really need the clot anymore. This is showing what would happen if a clot was inside. And so if you had like a cut on your arm, or say, this would be where if it's scarred, you wouldn't need the clot anymore, and the tough fibrin strands will dissolve, and the blood will take back the platelets and the cells from the clot. Blood flows continuously and smoothly throughout your body for an entire lifetime, but can quickly shut off to prevent blood from spilling out. Blood clots also form when your blood doesn't flow properly. If it pools in your blood vessels or in your heart, the platelets are more likely to stick together. Arterial fibrillation and deep vein thrombosis, or DVT, are two conditions where slow-moving blood can cause clotting problems. A few symptoms of these are sudden shortness of breath that isn't caused by exercise, chest pain, palpitations or rapid heart rate, breathing problems, and coughing up blood. Symptoms of blood clots depend on their location in the body. Some blood clots produce no symptoms until they rupture or become dislodged, and they travel through the circulatory system to other sites. Here I have a few more symptoms of a blood clot, like weakness, fever, and unusual warmth. A blood clot is most commonly caused by age 65 years and up, lengthy travel by a car or a plane ride that is over 4 hours, bed rest for long periods of time, obesity, pregnancy, family history of blood clots, smoking, cancer, and certain birth control pills. We have things that also happen to cause blood clots, like lack of exercise, and also not just birth control pills, but also other medications. The diagnosis of a blood clot is suggested by the history and physical examination and is often confirmed by imaging testing. Depending upon the location of the blood clot and its cause, treatment may require surgery or anticoagulation medication, or also a combination of the two. Some drugs stop platelets from signaling each other so they won't stick together and make that bond, but other things that can help a blood clot are medications called blood thinners, and these are 3 examples of blood thinners. And what those do is they make it hard for your body to make clotting factors, and they prevent the proteins in the clotting formation process from working. And a few of these examples are Eliquis, heparin, Xarelto, and warfarin. And so there are certain things that you can do, like these 2 are going to be orally pills, and this one is going to be an injection. A few other different things that you can do to help with blood clots are compression wear, surgery, stents, and vena cava filters. So today I have talked about what a blood clot is, symptoms, common causes, and different treatments. Imagine 274 people gone every single day due to something so small. Blood clots take the lives of those who don't even experience symptoms. Only 1 in 4 people have sudden death that is their first symptom of a blood clot. Blood clots often go undetected due to numerous different situations, but knowing these symptoms and causes can help prevent us from dangerous situations. And one thing that I kind of wanted to talk about is just kind of look around the room and think of, this was 6 minutes. So think of 1 of you would be gone in that short of time.